Hi, I'm Dr. Suraj Muralidhar. Today we'll be discussing about one topic which many of my patients feel awkward or shy to discuss about openly. What causes erectile dysfunction? How do you treat it? And a person who is having erectile dysfunction, can he satisfy his partner? So first of all, we should know that if a person is having erectile dysfunction, doesn't mean that he is having a serious pathological issue always. Sometimes there are also certain psychological conditions like depression, anxiety, performance pressure, and so many other psychological problems causing erectile dysfunction. However, let me also tell you about certain pathological conditions which actually cause this erectile dysfunction. Erection is mainly controlled by the blood flow into the penis. So, any defect in the blood flow causes erectile dysfunction. Many a times, patients who are having diabetes, hypertension, high cholesterol levels, they all have dysfunction of the vascular blood supply to the penis and they may suffer from erectile dysfunction. Secondly, there are certain hormonal factors like low testosterone levels, thyroid dysfunction, or a high prolactin level. They can also cause loss of libido and erectile dysfunction as well. Certain neurological conditions like spinal cord injury, Parkinsonism, stroke, etc., also can lead to erectile dysfunction. Certain lifestyle habits like smoking, drinking alcohol, and certain other sedentary lifestyle, metabolic syndrome, obesity, all these they can cause erectile dysfunction. And finally, I told you the most important, even if the patient is absolutely normal, still there are certain psychological issues which can cause erectile dysfunction like anxiety, depression, past sexual trauma, and performance pressure, etc. All these psychological problems also can cause erectile dysfunction. Now, coming to the treatment, yes, erectile dysfunction is most of the times easily treatable. So, first of all, certain simple medications, the most commonly be used being sildenafil, commonly called as Viagra, and tadalafil, and various other PDE5 inhibitors. They help in increasing the blood flow to the penis, and it's a very simple way to treat mild erectile dysfunction. Many times, certain neurological conditions, when treated properly, they help in curing this erectile dysfunction. If the patient is suffering from certain hormonal imbalances like low testosterone, just supplementing with testosterone, treating the thyroid dysfunction, they help in treating indirectly the erectile dysfunction. Many lifestyle changes like exercises, proper diet, having a good healthy lifestyle, preventing obesity, metabolic syndrome, avoiding alcohol, and avoiding smoking, all these indirectly help in general well-being and also help in treating of erectile dysfunction. And obviously, the most important factor which I had mentioned about the psychological factors, they play a major role. So, psychological counseling and treatment of the patient many times will cure erectile dysfunction. Now, coming to certain other medical treatments, medical and surgical treatments, we have certain vacuum pump devices which help in increasing the blood flow to the penis and thereby indirectly preventing the erectile dysfunction. They help in temporarily treating erectile dysfunction. Also, there are certain intrapenile injections which can be injected directly into the corpora cavernosa, and those are also useful many a times. And lastly, the surgical methods, we have different types of penile implants which are available. So these surgeries can be done and the penile implants help in artificial erection of the penis, and those are used in refractile cases where all other methods have failed. Can a man with erectile dysfunction still satisfy his partner? Short answer, yes. Even a man with erectile dysfunction, there are more important aspects to his sexual life like emotional connection, communication, intimacy, and mutual understanding. He has to concentrate more on these aspects. To conclude, I would like to say that erectile dysfunction is a very common, treatable condition, and any person who is having this problem need not suffer in silence or feel awkward. He has to visit his urologist immediately and take the appropriate guidance and treatment and lead a healthy life. Thank you.